very cautiously and very nervously back on air in our wonderful new studio in Salam Radio. I'm sitting quite sort of timidly, actually. I'm usually all out there, but this is such a beautiful studio. I'd really like to congratulate the Salam Radio team because of all the hard work that they've done. And it's wonderful to be here, this setup, and thanking the management that we're back. We're back after so many months of not being able to broadcast simply because of COVID-19. Assalamu alaikum, greetings, welcome to all of you on my very first, I call it debut show of the Body Health and Mind Show here on Salam Radio 106.2 FM. How I have missed saying those words to all of you. I hope that you've all kept well. It's your very own Dr Shabina Asad-Kiyum, who works as a GP at Central Medical Centre here within the city of Peterborough. Welcome back to all of you. Now, what have you all been up to during the whole lockdown? What a roller coaster it's been for so many of you. I hope that you're all listening and I hope that you're all comfortable, and please interact with me on the show. It'd be wonderful to see what you have to say, what your experiences are, and if there's anything that you want to say, put it into the chat. You know that we're again available on Twitter, we're available on Facebook Live, on YouTube Live, and if you want to get in touch with us and speak to us, you can call us on 01733 6021 33, or you can text us on 07411 191062. You can alternatively email us at studio@salamradio.co.uk, and it's absolutely fabulous to be back. And it's difficult to hold back that emotion there, but yes, I am. So I've had a really long day at work and I've rushed over from work here. As you know, being a GP is very busy, but I have absolutely looked forward to coming back. And I've got two wonderful guests with me on my show because, yes, we are talking all about COVID-19, and as exasperated as many of us may be feeling about this situation, it's very important to be able to keep you up to date, because I think that there's sometimes a lot of questions that arise, and people gain a lot of information from social media and the television and listening to the TV. But I want this to be a positive show. I want it to be as positive as possible, and for you to relate to it and know that this is for you. This is for all of you, because that's how we work here at Salam Radio. We are a station that looks to building bridges with every community, and every community, irrespective of what your background, ethnicity or religion is, we welcome you all. So it's great to have you all on board. Now, today, I've got two professionals that I've looked really forward to having on the show. I'm going to introduce them before I bring them on. And the first is Dr. Tony Jewell, who happens to be a consultant in public health here in Peterborough. And I'm going to give you a bit of background about Dr. Jewell. He's an experienced professional, having been a GP in Tower Hamlets for 10 years, where he helped establish a teaching and research health centre. He moved to Cambridge to train in public health and was appointed a Director of Public Health for Peterborough in the 1990s. He was then the Director of Public Health for Norfolk, Suffolk and Cambridgeshire's Strategic Health Authority in the early 2000s. He was Chief Medical Officer for Wales between 2006 and 2012, during which time he helped lead the response for the Welsh Government to the 2009 H1N1 influenza pandemic. And during the COVID pandemic, he's had a particular focus on Peterborough and works with community and faith groups and Peterborough City Council Rapid Response Team, as you know, are very active at the moment in trying to engineer and deliver the COVID vaccination programme, as well as the COVID programme as well, the testing and tracing programme. And it's wonderful to have Dr. Jewell as well. And I also have Dr Azhar Chaudhry, who is our very own GP here within Peterborough. And he's a GP partner and he's a GP trainer. He's also a member of the British Islamic Medical Association. And Dr Chaudhry, I mean, no introduction would be enough for him, because he's done so much work with regards to delivering cancer screening talks on behalf of the British Medical Association in various settings like masks, etc. And he's helped with COVID programs and vaccination programs as well. And he is really very passionate about giving the right messages to our communities and improving health outcomes to those communities as well. So I'm going to bid them both a very warm welcome. And I'd like to say welcome, both of you. Assalamu alaikum, and thank you for joining the show. So, Dr. Tony Jewell, thank you very much for your time with us today.
That's fine. I'm pleased to join you, and thank you for the introduction.
Thank you. And Dr. Azhar, tell me, have you had a long day at work today?
Yeah, it was indeed a long day. Thank you for having me.
Well,
went better than yesterday.
Oh, well, I think that between yesterday, because we got a bit mixed up with the dates, it was good to see that we've got your expertise on board today, and it's wonderful to have you. And we've got a salam, Dr. Shabina, from a brother Munir Ahmed, who listens to us all the way from Leeds. So, walaikum assalam, brother Munir. Thank you very much for coming on board, and it's wonderful to see you. You are an avid listener of Salam Radio even before the lockdown. It's wonderful to have you on board as well as all of you. So come on, bring those comments in. We really want to hear from all of you. Now, we are still in the midst of a lockdown, although the Prime Minister has announced some easing measures. So, Dr. Jewell, if I could come to you, please, first of all, what is the state of affairs regarding COVID-19 here within our own city of Peterborough, please, for our listeners?
So I wish I could give you really good news, but unfortunately, on terms of COVID in Peterborough, the situation is not as good as we would have hoped. And Peterborough is now actually in the top 3 in the whole country in terms of cases. So that's very, very sad to have to report to you. So they talk about cases per 100,000, and the latest rate in Peterborough is about 270.
Okay.
And that compares to Cambridge, which is 66.
Right, wow. Rather stark difference.
And it compares also to England, which is 122. So it's more than twice England rate, and it's something like a quarter, 4 times higher than Cambridge. So we are worried about it.
Yes.
And just to put it in perspective, Peterborough has been one of the government's areas of concerns way back in the first wave in 2020. And at that time, the rate when they were worried about us was 25 per 100,000.
Okay.
So before people, think too much about easing off our kind of masks and social distancing and stay at home if you can, I think we've probably in Peterborough got to continue a little bit longer to try and make it go down further. Yes,
I think I really do agree with you. And just coming in there, we've just had another comment as well from Mr. Asad Qayyum. Salam, Shabina, welcome back to Salam Radio. Great to have you back on air. Great studio. Thank you very much. And we have Brother Faisal Mahmood. Good to have you back. And it's good to have all of you back as well. And just, sorry to interrupt you there, Dr. Jewell. It is of concern, but I think there's a really important message in what you say, that we shouldn't think and be too excited about easing down on those measures of social distancing. They're still as very important, because we are, in terms of rates per 100,000, above the national average, aren't we, here in Peterborough?
Absolutely. And, we will come on to the good news, which is about the vaccination and encouraging people to accept the vaccination, which is a really good news story. But at the moment, the picture in Peterborough is that we've got to continue to be very careful about social contact, because what we've learned, and I'm sure you know very well, is that this virus is easily transmitted, and the new variant is even more transmissible.
Yeah.
And it's really person-to-person contact, especially indoor environments.
Yeah.
And, I think we've got to redouble our efforts about, being careful, keeping not having people visit your household still. And if you are out and about and going into shops, to wear a face covering and try and maintain social distancing as much as you can.
Yeah.
And really, all the advice we've been giving is as important as it was. That wash your hands, face coverings, social distancing, and also ventilation in houses. And I think in the cold weather, maybe people haven't been keeping the windows open as much as they could. So if you do have people indoors, then you have to open the windows to get the clean air in.
Sure. And I guess one begs to ask the question, Dr. Jewell, with regards to why is it that we see with regards to Cambridge, the factors need to be identified as to why the rates are high. Could you give our listeners any information on what the reasons are behind why we're still quite high in terms of rates per 100,000? Because that would be good to communicate so that we can act on then pertinent steps, just as you've given now, actually.
Yes, so I mean, one of the reasons in Peterborough is that the workforce in Peterborough, unlike Cambridge, working at home is not really an option for many people in Peterborough. Mm-hmm. So in some areas, people can work at home quite comfortably, but many of our population in Peterborough have to go out to work.
Sure.
And going out to work means that you are in contact with other people when you travel to work. Mm-hmm. And also some of the workplaces people go to, you are in face-to-face contact with other people.
Sure.
And, that's one of the reasons I think in Peterborough we found quite a lot of workplaces have outbreaks. Obviously people work there, have to get to work, get back from work, and then maybe spread it indoors.
Sure.
And that's been one of the problems in Peterborough compared to other areas.
Sure. And given
the second thing is because some of the workers are not on really good contracts, means that people in Peterborough we think are not isolating or not getting tested when they may need to, for fear of losing their job. Yeah. And so that means that some people are working either when they have symptoms or even gone back too early because you're meant to stay off for 10 days if you're positive. Mm. So those sorts of things are some of the factors in Peterborough compared to, Cambridge or South Cambridgeshire.
Sure. Well, I guess that it'd be important, wouldn't it? Because Peterborough is quite a heavily what we call industrial area as well. We've got many businesses here too. And do you think there'd be any room for businesses to revisit their risk assessments? For example, we've got big manufacturing industries or engineering industries. And do you think there's room for these places of employment on such a large scale to be rechecking and revisiting their risk assessment processes to protect their workers?
Absolutely. And, I think during the process of the pandemic, we've had a so-called workplace cell in the public health department. Mm. And when there are outbreaks in workplaces, there are meetings and visits and risk assessments looked at. But one of the things we found is that some of the workplaces are actually very good because some of them are supermarkets, food, wholesale, warehouses, those sorts of things. Okay. But actually, when you look at it, they have got risk assessments, so they have got processes. And that's a bit like the schools, really. It's how people get to the workplace, what they do after work, whether they share cars, whether they go in a minibus. There are all these sorts of factors you need to think about. It's like people going to school and standing outside the school chatting to other people and milling around. Those are opportunities for the virus to spread. Yeah. Things like car sharing is a risk. Yeah. So I think the workplaces certainly we are looking at and have looked at. But it's not just the workplace, it's how you get there, how you get back, and then people sometimes meet after work and so on. So
sure.
Those are the sort of risks, yeah.
Okay, well, thank you very much for that. And on that note, Dr. Azhar, I'd really like to bring you in on here because obviously you work in a practice that has one of the largest, in fact, if not the largest patient population within an area that has been identified as a hotspot in Peterborough as well. How are you finding it in terms of your experience and exposure to patients? Do you get many patients who you're seeing with COVID-19 related symptoms asking for advice?
Yes, we are the largest actually from the single site in the whole Cambridgeshire practice. So people are still asking for the symptoms and the testing, and recently actually for last few weeks there are quite a few people who are done the coronavirus tested positive. Yeah. And it's quite common to actually query about job and money and all those things. How they're gonna manage their houses, bills and stuff. Yeah. but it is widespread, and I mean, come across many families. The whole family are positive for coronaviruses,
Yeah.
and it's all across the population. It's not any particular area. So it is not a good news, especially if the country is opening up. But I think they might go back to the tier system, and Peterborough might be the higher tier system, even the whole country is open up. So
Yeah.
everybody has to take it seriously. Virus is still here, although the cases are going down and the vaccinations, are helping. It's gonna help, but still the safety measures are still there, and hand wash, wearing the mask, and keeping the distance. As Tony said, that going in open areas and all those things going to be still in place for foreseeable future.
Yeah. Yeah. I'd like to
So
ask. Yeah. Sorry.
yeah,
Please
I
finish.
don't have any clear answer about why is the case. I mean, Tony made a very few good points about most of the population is they are like a daily wages. They go out for work. They can't work from home, and we can observe that on the roads. Basically, the first lockdown was very effective. You could hardly see any car outside.
Yeah.
So only we are the key worker were on the roads. Otherwise, everything was locked down.
That's right.
But this lockdown was different, and still roads were full. And
Yeah.
if you watch listen on Islam radio in the morning, they will give you the traffic update, and they will say that road is blocked, that road is blocked. That looks very unusual. If there's a lockdown, why the roads are blocked?
That's right.
So it's mostly because of due to the work. People due to work, they have to go out. Basically.
Yeah, and I do agree with you. And on that note, Dr. Azhar, would you like to give our listeners again some of the symptoms and facts about COVID-19 and what to look out for? I'm sure that they're all well versed, but there's no harm in repeating that. And then we'll talk to Dr. Jewell a little bit about the variants as well, if that's okay.
Yep.
Yeah. So, I mean, as we know that now it's starting in December 2019 in China, and then at the beginning, I remember during the first lockdown in April-May time, I come across few patients. They thought it's a fake news. The virus is not real. You're just making it up. And now it's clear that it's not a fake news. We are more than 121,000 deaths in the UK, and worldwide, like 2.5 million people died due to coronavirus. So it is real. It's not a fake news anymore. And we also know that older people, and people with the chronic condition are more vulnerable to this condition.
Yeah.
And also the people from ethnic background, and that's so important for us to take it so seriously. The people from back in ethnic minority people, all the evidence show that if they get the condition, they get a serious side effects, they get serious complications. They are more stay in the hospital as compared to other people, and also the death rate as well. So that's a fact now. And the complications are so important. Now we know about another term. It's called long COVID.
Yeah.
And we've seen so many people with that. And we don't know what to do. To be honest, we've done everything we could, but they still got the symptom. They got the shortness of breath. They can't walk. They can't work. They feel tired.
Yeah.
And other complications just come after, when you recover from the COVID or the clots in your lungs. And I had two friends, they were consultants. One was in Saudi and one in Kashmir, Muzaffarabad. They both had pulmonary embolism and died after COVID.
Oh my goodness, that's really sad to hear.
One was a surgeon, one was a cardiologist. So it's so real. And you can get heart failure, kidney failure, neurological symptoms. One of my family friends' sister had this one, and what's happened to her now is she just suddenly collapsed, and she doesn't know why.
Wow.
So these are all post-COVID complications. Why I'm emphasizing on these complications? Because the vaccine is going to help you reduce these complications, and that's so important. I think we need to emphasize at our workplace all these things because due to vaccination, what's going to happen is we don't know yet whether the vaccine going to stop the spread of the virus, but we do know that it's going to reduce the severity and it's going to reduce the duration of the illness, and that's so important. If you have a less severe illness, you're not going to go to hospital. You're not going to get these complications I'm talking about. you're going to save time, and it's going to be, save your livelihood. And all those things come in play when you think about these things. So we're going to discuss about the vaccination later on in the program, but I think that's so important, to keeping in mind these complications.
Yeah.
And that's the vaccination job, to, avoid these or reduce all these, the severity of the symptoms.
Yeah, I think that message, actually, the pertinent message that you've given with those examples of people that have suffered from complications is really important, because not many people, in fact, wasn't aware, even despite being a clinician, that pulmonary embolism can take place as a result of long COVID. And you're very right about lack of sort of the expertise in this area in regards to long COVID and how people are being affected by it. And you're absolutely right. Sometimes just as general practitioners, it's an area that you feel quite out of your depth. And I start Googling things to have a look at the NHS resources that are available and where people can get information. There is stuff online that, I'm happy to share, obviously, offline later on with the Salam Radio listeners. But coming to Tony, the variants. Now, could you tell our listeners a little bit about what variants there are and how prevalent they are within Peterborough? And if those variants, for example, yes, you've told us that they are more easily transmissible, but in terms of, would you say that they are more severe? Would they cause a more severe level of illness at all?
I don't think people think that at the moment.
Sure.
But just if we look back to just before Christmas, do you remember that time when the Kent variant, so-called, the one that started in, or at least was identified in North Kent, that went through, London, northeast London, then it went into South Essex, into Hertfordshire, and then it came up to Cambridgeshire. And do you remember those? And your listeners remember those kind of things on the news when you suddenly saw these areas, red areas, spreading up from Kent into London, into South Essex, and it was coming up our way to Peterborough.
Yeah.
And that has been referred to either as the Kent variant because of Kent, the county, or worldwide it's sort of the UK variant. And that one was the one when the government started to come out more strongly with something about, Christmas was only be Christmas Day, and it cut back all the planning that people had done over the Christmas holiday time. Mm-hmm. That was because they noticed that it was more transmissible.
Okay.
So they thought that it was 50 to 70% more transmissible than the one that we'd had before.
Yeah.
And that is the predominant variant in the UK. That one is still the most common variant.
Right.
But then you'll remember that around about the same time, suddenly the Minister of Health suddenly came on and said there's something called the South African variant. So, often they point to the countries where the variant was identified.
Mm-hmm. Mm-hmm.
And so this one is in South Africa. And that's when the government stopped flights from South Africa and tried to chase and follow up people that had arrived from South Africa 2 weeks previously. And that's been their policy, to try and stop the South African variant, which is different to the Kent variant, from spreading in this country.
Right.
And there have been all across the country what they call, surge testing, when they go around and test communities because they know that someone in that community's got the South African variant. But luckily, because of that, closing the border from South African passengers, as well as chasing people that may have the South African variant, I think the government feel that they've got the South African variant reasonably under control. Mm-hmm. But we can't be absolutely certain of that. And the other one that hasn't really caused huge problems for us is one that's Brazil variant,
right.
Which has been causing problems in Brazil as something that they're finding difficult to control. So basically, all viruses, as you know, they mutate, they change, and all these variants are just changes in the COVID virus. But the trouble is that sometimes when the virus changes, they can become more transmissible, like this one is. But at the moment, there's no evidence that it makes you sicker or causes more deaths than the UK variant. So I think that's good news. And the good news is that both of the vaccines currently being used work for the variant. And I think the government, the reason they're pushing the vaccination so hard is that they want actually to try and stop COVIDs, in the community in order to stop these variants getting a foothold. So that's why the vaccinations are being pushed very hard.
Sure. Well, it's good to have that. And we've just reached our break now. We're going to be going to a break in the next 20 seconds. So I'd like to request both of you to stay, because after the break, we'll be talking a little bit about, well, not a little bit, as much as we possibly can, about some of the myths associated with vaccinations. And with your help, listeners, it'd be great to have you. So see you all after the break.
Stay tuned to Salam Radio after this short ad break.
The census builds a picture of our community. When you fill in yours, you help make decisions about things that matter to you.
Like our local hospitals.
Better transport connections.
School places.
Census Day is the 21st of March. Look out for more information in the post or visit census.gov.uk. Census 2021. It's about us. Delivered by the Office for National Statistics.
Park Foods now has free car parking. That's right, park for free for up to 1 hour at Park Foods, the largest ethnic supermarket chain in the East Midlands, now open in Peterborough with the biggest ethnic supermarket in Cambridgeshire. Fresh quality fruit, vegetables, dairy produce, halal meat and poultry delivered to us every day. Park Foods carry a huge range of brands from around the world and thousands of products in our daily use household range, and all under one roof for a one-stop shop experience. Shop in comfort and safety in our large, clean and friendly store. Come and try the difference. All government COVID-19 rules followed. Park Foods, 232 Lincoln Road, Peterborough, PE1 2NE. Open 8:30 to 8 Monday to Saturday and 11 to 5 on Sunday. Remember, now park for free for up to 1 hour. No more pay and display. Yet another reason to shop with ease at Park Foods.
अब खुल गया है देसी रेस्टोरेंट, तो क्यों ना आज ही अपने घर वालों के लिए खाना ऑर्डर करें। हमारे पास फिश पकोड़ा, चिकन पकोड़ा, चरगा स्टीम चिकन, लेम और वेजिटेबल समोसा, बिरयानी, पिज्जा, फलूदा, जलेबी, गुलाब जामुन, समोसा चाट, फ्रेश चिकन और लेम हांडी, लाहौरी चना और बहुत कुछ। ये सब अब आपको मिले सिर्फ और सिर्फ देसी रेस्टोरेंट में। आज की स्पेशल ऑफर, निहारी और पाए 1 नान और रोटी के साथ सिर्फ 6 पाउंड में। स्पेशल लंच टाइम ऑफर दिन 12 से 4 बजे तक। चिकन और लेम कड़ी 2 रोटी के साथ सिर्फ 6 पाउंड में। मिक्स वेजिटेबल कड़ी और तड़का दाल 2 रोटी के साथ 5 पाउंड में। तो ऑर्डर करें अभी देसी रेस्टोरेंट online.com पर और ऑनलाइन पेमेंट करें बिल्कुल सेफली, और कॉल कर सकते हैं 01733555795। हमारे पास डिलीवरी भी मौजूद है और 10% डिस्काउंट के साथ आप खुद कलेक्ट भी कर सकते हैं। 298 लिंकन रोड, पीटरबरा, PE1 2ND। देसी रेस्टोरेंट, आपका अपना पसंदीदा और मयारी खाने अब पीटरबरा में।
दोस्ता की परेशान है
जरा कर ना सारा सौदा मुक्या वा मुल्का विच पैसे भेजने
हूं नहीं अमार फूड वाले की फोन खड़का ते फ्री लोकल डिलीवरी कार मंगवा
आला ता उथे का स्पेशल आ
ओना की लबाई हाइजीन च ग्रेड 5 चीजें चंगियां म्यारी ते सस्तियां ते नाले ऑफरां ही ऑफरां और क्या ताजा गोश्त, ताजी सब्जियां ते फ्रूट, आटा चावल दालां मसाले ते जूस सारे बिल जमा करने, गैस ते इलेक्ट्रिक ने टॉप अप भी करने। पाकिस्तान पैसे बिल्कुल फ्री भेजने, मतलब के एक चिड़ी ने दूध छड़ी ते हर शय लबनी।
जने ने आप उतरा
Amar Food Store and Halal Meat, 613B Lincoln Road, Peterborough. Telephone 01733 687374.
On Facebook at Salam Radio.
Bismillahir Rahmanir Rahim.
Assalamu alaikum. Welcome back to your very own Body Health and Mind show with Dr Shabina on Salam Radio 106.2 FM. So we've been having a fantastic show. We really have been, with wonderful two experts in their own field. We've got Dr Azhar Chaudhry from the Thistlemoor Medical Centre, who's a GP partner there. And we've obviously got Dr Tony Jewell, who's a consultant in public health. Before we go back to them, I'd just like to make an announcement, which is all about Census Day 2021 on the 21st of March. So did you know that it was Census Day on the 21st of March? And I wanted to make you all aware that the census is a really important survey, and it happens once every 10 years. And why is it important? Because it gives us a picture of all the people and households in England and Wales. Well, why would that be important, may you ask? It's very important in terms of representation as well, and in terms of knowing how many people, in terms of different statistics, what their ethnicity is, what their background is, etc., etc. It's very, very important for data and reports. And all kinds of organisations, from local authorities to charities, they use census information, and it helps to provide the services that we all need that are important to us, like transport, education and healthcare. Now, the census is very, very unique, and this is why I'm giving you this message, because there's simply nothing else that gives so much detail about us and the society that we live in. And by law, every household has to fill in the census. Do remember that the Census Day is the 21st of March. We'll remind you about that. And it's going to mainly be online this time. However, if you need any help, they're offering a wide range of support services to make sure the census is as accessible and inclusive as possible. Whatever your needs, the support services can help you complete the census. And the translations are now available in an incredible 49 languages. And additional support is available online, on the phone and in person to ensure you can read, understand and complete the census. So please make sure that you fill it out on the 21st of March. It's about the future of our communities, and it's about everyone getting help. And on that note, because we are talking about people getting help, and it is a pandemic, we do have to bring our wonderful guests back on air. And we've got Dr. Tony Jewell and Dr. Azhar, and thank you very much for waiting there with us. And in the meantime, I'll read out some comments. So we've got Brother Munir Ahmed. First and foremost, it's so good to have you back, and we really look forward to many important and informative shows on the body, health and mind. The new studio looks really good. Well, thank you very much. And we also have Sister Suleika Balde-Mbalo. Assalamu alaikum, sister. Nice to see you back, and thank you. And it's nice to have you all back as well. And welcome back, all of you. And do interact with us again. You can call us on 01733 602 133, or you can text us on 07411 191062. We're also available on YouTube Live and on Facebook Live, and we're also available on Twitter. So please play your part. Ask us questions, because that's what we're here for. Now, Tony and Dr. Azhar, thank you very much for waiting patiently there. We were talking about the vaccines, and I think our second half should be devoted to vaccines. So coming to you, first of all, Tony, could we talk a little bit about the different vaccinations that are being administered in Peterborough, and then we'll go to Dr. Azhar a little bit about how they are delivering the vaccine programme.
Yeah, thank you. So it's amazing that we have a vaccine that works and is available within a year of the pandemic.
Yeah.
Absolutely amazing, because it's never been done in history before. And we're very, very lucky, because if you think about some viral conditions like HIV and AIDS, that's been with us for more than 30 years.
Yeah.
And there is no vaccination for HIV.
Yeah.
There is treatments, but no vaccination. So we're really, really lucky to get, not lucky, but we're blessed, I suppose, to get vaccines, and to have two that are being given out across the UK. There's a third one that's arriving, it's been granted licensing and will arrive soon, but they're basically two. One is called the Pfizer one, and one is called the AstraZeneca one. So I call it, Pfizer or AZ.
Yeah.
And your listeners will remember that the Pfizer one is the one that originally had to be kept at a very cold temperature, minus 70 degrees. And that meant that when it was first launched, it was basically being used in so-called hospital hubs. So Peterborough was one of those where the Pfizer vaccine was being given from the Peterborough hub. But the AstraZeneca one doesn't need that minus 70. It can be kept in a normal refrigeration.
Right.
So that was one that was more commonly used, away from having to have a very cold storage. But in fact, both of them have been shown to be effective. I've just been looking at my emails, and a few weeks ago, when we were looking at care homes across Cambridgeshire and Peterborough, there were more than 120 outbreaks in care homes across the patch. And you know that COVID affects older people very badly.
Yes.
And it was just amazing that we had so many outbreaks in care homes. I've just looked at it now, and it's down to 13, and I think there are very few new ones.
Yeah.
And that's because the vaccine is being, by GPs particularly, given to residents in care homes and staff. So we know that about 90% of care home residents have had the vaccine, and many of them actually would have been up for a second dose. And this is having a major positive benefit to old people, which we've seen in the reduction in the number of outbreaks in care homes.
Yeah.
And that's just wonderful news. And our hospitals are they're still very, very busy, because unfortunately patients with COVID often stay in hospital for a long time and get those long-term effects that Doctor was talking about earlier.
Yes.
But actually the hospitals are less busy than they were.
Yeah.
In Peterborough, there are about 80 patients with COVID in Peterborough, but there were a couple of weeks ago 120 or more.
Yeah.
So I think the message of the vaccine is it's being given across the country to nearly 20 million people now, and there are very, very few side effects. And already we're getting reports of the benefit, not in just care homes, but also hospital admissions. And in Scotland, there was evidence of far fewer deaths as well. So I think there's really positive news. And what we're worried about is that some people aren't taking up the invitation to have a vaccine, and that's something we want to work with radio, like Salam Radio, to encourage people who might have genuine fears or been told something that's not right and are worried about the vaccine. And we've got to make sure that everyone who is offered it accepts it.
Sure.
I
think you've given some really encouraging statistics there, Tony, because obviously, yes, whilst we have a higher rate than the national average in terms of COVID rate infections per 100,000, we do have a robust vaccination program that is being rolled out very efficiently, I must say. And coming to you, Dr. Azhar, with regards to giving the vaccine, so how is it working at the moment in general practice, who are inviting people? How does it work for the benefit of our listeners to understand? Because I know as a GP, and I'm sure you have, I've had quite a few people actually speak to me and say that when am I going to be invited for my vaccine? And it may not be time to invite them yet because they're sort of in their 50s or in their 40s, etc. But how are you finding your experience? And could you explain the process to our listeners, please?
So the listeners, for our practice, we got our own vaccination center. Obviously, it's under the PCN.
You're working with us, aren't you? We're working together, aren't we? Yes.
With Central Medical, So, and we working through the priority list that's made by the GCVI.
Mm-hmm.
So we go through that, and I think we are now 70 plus higher risk patient.
Okay.
And there were some supply issues. So because of that, we normally been giving like a couple of days a week in the afternoons. But at the beginning, when Pfizer was available, we were working over the weekend as well. For 2-3 weeks, I think we've been working continuously. You have to give like within 3.5 days. Otherwise, you cannot store it. So that was a busy time. And I think when the second dose is going to come around, it's going to be busy again. So it is going smoothly, but it's not that fast as it was at the beginning because there are other centers open up as well, and people are getting invitation from everywhere.
Yeah.
But it doesn't matter there was one question today. A patient was asking that I want to my surgery. Why is I have to go somewhere else? So it doesn't matter. It's a different system they use for the vaccination. And at the vaccination hub, we don't have access to the patient note. and there is no any contraindication unless you are allergic to any ingredient of the vaccine. There was no any other contraindication. People ask so many questions like, I'm on diabetes medication, I'm on heart medication, whatsoever. There's no contraindication for this vaccine. Only the people with the blood thinner tablets, if they are on blood thinner tablets, not warfarin, but on other blood thinner tablets, where you don't have to monitor their blood tests, they just need to tell them, and they're going to put more like a plaster on it for a few minutes, and that's all they need, the more pressure. It's no harm getting vaccination with the blood thinner tablets. If you are on warfarin, that's another type of blood thinner tablets where you have to monitor your blood test called INR. As long as INR is in the target, you can still have vaccine. There's no contraindication for that. So normally they ask you a couple of questions, and also you are well at that day. You don't have any fever, and those kind of things, as you do in the flu vaccination. So they ask those questions. So you can go anywhere in Peterborough. There are so many centers now to have a vaccine. And when you have a vaccine, we're going to get the record of your vaccine. So you can come to your notes. So we know that you had a vaccine. So, there's no any contraindication as such. And the side effect-wise, I had it, you had, and most of the people have it. So it's basically the basic side effects are fever, headaches, and generalized body ache, chest loss for 24 to 48 hours. I didn't have any fever or headache, just the body aches.
Yeah.
I think few patients came back to me after the second dose, and they had a bit more severe symptoms in terms of fever, lasted for a couple of days, and headaches. But they are all reversible. There was a myth about that people having irreversible side effects, but there's no evidence show that. So they are reversible. They can go away within 48 to 72 hours, especially after the second dose. And I think people should, that's the only way out from this pandemic, is the vaccination.
Sure. I think you make some really important points. But and coming back to Tony, before I ask about, how people can be notified, because that's one of the questions that we often face. Obviously, it's plain to see that people from Black and ethnic minority groups have been disproportionately affected by COVID-19 in terms of infection rates. But I'm very conscious, Tony, of using names like hard to reach groups, because I feel that in my own experience in primary care, I've had a lot of people from ethnic minority groups who've wanted to seek to have the vaccine. And there are so many messages, and Public Health England has worked so hard locally as well to try and get those messages out so that people understand them. And I think that it would be wiser to say that because people don't have probably a better understanding in their language, because of those populations that have English as a second language don't have a greater understanding of the vaccine, it would be better to communicate that. And I think that people are very conscious of discriminations coming out of our sort of discussions about directing or focusing on these groups, such as Islamophobia, for example, or stigmatization of certain groups. And that's something that I have been very wary of. And I've had a few conversations with patients who are very encouraging of wanting to have the vaccine. And I think if we are able to talk to them clearly about accessibility and how to access the vaccine, as well as giving important messages on communication and where they can access the right information, then those paired together are better, aren't they? What view do you have on that? And could you give us a little bit of insight?
Yeah, you're absolutely right, because what we're worried about is that, certain parts of groups of the population aren't going to have the vaccine. And that's not just South Asian people. It's Black African, Black Caribbean people we know. Filipinos, we know in the NHS, quite a lot of Filipino nurses who've not come forward in the way that, people had hoped for. So if you like, it's not just the Pakistani population of Peterborough, it's also a Black population, and Filipino nurses and so on. So we know that care workers, for example, while we've immunize 90% of the residents, it's still only about 60% of the staff. And that's not high enough, because what we need is 75% of the population to be immunized, because we want to try and push COVID off the UK. And you need to have a high proportion of the population that are resistant to it.
Yeah.
So 60% in a care home is not good enough. And we know that some of those staff are worried, and they've got important, concerns, some of which may be, not correct, might have been picked up off websites, off social media that are incorrect. And I think you're quite right that what they're looking for is an opportunity to talk to someone who, what we trusted person, like yourself as a GP, go and talk to the GP, talk about the worries. For example, quite a lot of care home workers, we've been told, are worried about future pregnancy.
Yes.
And we know that there's absolutely no worries at all about the COVID injection and future pregnancies.
Yeah.
The only reason that pregnancy has been raised is because the trials of the drug didn't try it on pregnant women for obvious reasons, because you don't try a new vaccine on pregnant women. So that's why the vaccine is saying it's not being shown for pregnant women, but that's only because the trials weren't done. And many obstetricians actually are recommending it now for pregnant women.
Yeah.
But that's meant that there are people saying, oh, if it's not right for pregnant women, then I think I might get pregnant in the future. Maybe I shouldn't have it. But that's something that they need to talk through.
Yes.
With their GP, with someone that they trust, and don't look at social media, internet, where you're not sure who the person is giving that advice, whether they know what they're talking about, because I've seen some of those internet things that are completely wrong, and it's what's called fake news.
Yes.
So people must be very careful and take advice from a trusted person. And there are information in different languages and different formats, and that is available. And so I think, that would be the advice. Find someone that you trust, and if they're from your same community, great. And we want to try and spread it out in Peterborough, because we are worried that there'll be a group of the population not coming forward.
Yes, that's right. And I think that it's so important. And thank you for clarifying that about the different groups that haven't actually, there's not very high uptake of the vaccine, that it's not just to focus on one particular ethnic or religious group, but actually there are a number. And I think that that's important for viewers to hear, that this isn't channelized to one particular group and that everybody's treated equally. However, sometimes it can be difficult to access that information. That is why many messages have been put out in various languages. And coming to you, Dr. Azhar, would you like to tell us a little bit about some of the myths, because you're doing some fantastic work on behalf of the British Islamic Association, Medical Association, and they've actually put up quite a few answers in response to the myths. What are the common myths that you have come across and the answers to those myths, looking at the time as well?
So we've been calling patients who refused or didn't take up the invitation for vaccination. So data so far in our surgery, I got till 17th of February. That was last week. And this is also only Thistlemoor Central is not including this data. So it shows that the English people is 86% uptake.
Okay.
And 14% whether they refused it or they did not make an appointment. In Eastern European country, people from there is 33% uptake and 67% whether they refused it or they're still waiting to make appointment. And Urdu speaking 53% uptake and 47% of them whether they refused it or they did not make appointments. And others are 35%. So you can see that there is a big difference. And 86% one side and 53%. That's why it's important. Although it is across the whole community, Eastern European, Black Africans, everywhere, but it still is a big figures. So we need to work on those ones.
Yeah.
So when you call the patient, I've been calling from last few weeks, and I remember one of my partner was saying that he called 60 patients and only able to convince 5 of them to have a vaccination. You can see the mountain we need to climb.
Yes.
The common they would say that is the main one was I need a bit more time, or they would say that we'll think about it. So I do ask what you want to know more about it, or why you want to wait. I think deep down they just think that they're going to wait and see if any side effects or complication come up in a few months' time. But I think looking at the research and when they were developed, they done so much, thousands of people being included in the clinical trial, and they could not find any complications. And looking, although the vaccine was made with very rapid period of time, but the clinical period was almost the same as you do in the normal vaccine manufacturing, because the number of people was available.
Yeah.
And in normal time, they take time, they need the money, you need the resources, all the paperwork. The paperwork for a vaccine in normal time takes 3 years. And this, during pandemic, only took 3 weeks.
Yeah.
You can see how the period was shortened. So that's why normally you try to reassure them that there's a safety measure being taken before these were approved for the country. We explain all those things, but these are the two bits are very difficult to tackle. And then the people say the people died after the vaccine. There was our patient was died. He had a vaccine like 10 days before. That was a coincidence. There's no link between vaccine and the death so far.
Okay.
Some was worried that I will get COVID-19. Says no. Again, it's a dead virus. It's a dead, vaccine. There's no live virus in it. It can't give you COVID. So these are the few questions they asked. And also one of them was, we're going to get an irreversible side effect. So we normally try to reassure them that there's no evidence so far, even in the trial. And now is, how many people have vaccine, and there's no such evidence saying that there are irreversible side effects. Is it halal? Yes, they both are halal, and third one is halal as well. That's most likely going to come in shipping, like in 3-4 months' time.
Yeah.
But they are halal. There is no such a thing. I mean, British Islamic Medical Association, they done so great, wonderful work on this one. You can see every day there is some infographic coming on the social media. Muslim Council of Britain supported it. MENAB supported it. All the main, the stream media, Islamic media, they all supported this vaccine. So there is no such a thing halal in this in the vaccine.
Yeah.
So here are the few myths. And the one Tony already addressed about the fertility. Normally there's no any. So advice is if somebody had a vaccination after 2 months of second dose of vaccination, they can try for pregnancy. There's no any harm whatsoever.
Right, that's good to know.
So,
that's good to know. Yeah. We have a question. It's from Facebook, Brother Munir Ahmed. Do we know how long did the trials of the vaccines go on for before being rolled out? In this particular case, the COVID vaccinations, we'd like to talk. And I think that there were different lengths of time that they were trialled for, weren't they, before they were approved here in the UK. Is that right, Tony? Would this be directed towards yourself, and would you be able to elaborate on that?
Yeah. Yes, I mean, I think, people, because of what I said at the beginning, is that it's amazing that we've got a vaccine that's been licensed so fast. People are saying, oh, well, why is it being done so fast? And one of the reasons is, of course, the world has been trying to develop the vaccine. All the governments have been investing in the research and supporting the drug companies to produce them, whether that's in China, whether it's in Russia, whether that's in India, whether that's in America, whether that's in the UK, whether that's in Europe. Everyone's been looking to develop these vaccines, but none of them have not done the safety trials that are needed to satisfy the regulators, because people have to remember that the regulators are not part of the government.
Yeah.
And they're not part of the drug companies, so they're not in it for the profit.
Yeah.
And they're not in it for this, to please government ministers. So they are independent, and so regulators in Europe, regulators in the UK, regulators in America, regulators in China, regulators in India have approved these vaccines, and basically they've approved them because the safety trials have been done scientifically and satisfactorily.
Brilliant. Now,
I don't think people should worry about the safety, because after all, 18, 19 million people in the UK have had the vaccine. And believe me, our media is such that they'd be all over someone
if they weren't, if it wasn't. That's absolutely right. We have 45 seconds left. I just want to ask a really quick question. Somebody has stated that if you have COVID-19, you then don't need the vaccine because you're conferred natural immunity. That is obviously not correct, is it?
No, it's not right.
We don't know how long the immunity lasts from gaining COVID-19, and actually having the vaccine would decrease the severity of any infection if you were to subsequently have it, for example, isn't it?
Yeah, absolutely. Got to have the vaccine. Got to have the vaccine.
So last 10 seconds, I really want to thank you for both coming on board, and for all my listeners, thank you for my debut show here today, and we will indeed have you all back on. Assalamu alaikum.
Stay tuned to Salam Radio after this short ad break.
Park Foods now has free car parking. That's right, park for free for up to 1 hour at